It's the Brian Lehrer Show on WNYC. Good morning again, everyone. Now we continue our WNYC Centennial series, 100 Years of 100 Things. This year-long series began in July on the day that WNYC turned 100 years old. The show committed to passing forward the station's history of trying to be interesting and educational and relevant to today. In every year, we will try to keep it up for the rest of this series as we are entering the new year with things number 54 and 55, 100 years of birth rates and 100 years of life expectancy and causes of death in the United States. We did birth rates on Thursday. Today it's 100 years of life expectancy and causes of death. This is both a remarkable and very relevant to today history. Remarkable because if we go back to the year 1860 as a starting point, the average life expectancy in the United States was, think about it, what would you guess? It was less than 40 years old. According to the statistics website Statista, people in 1860 in this country only lived on average to 39.4 years old. 20 years later, in 1880, that was unchanged. But then a remarkable increase began. In 1905, life expectancy had increased to 50 years old. By 1935, it was up to 60 years old. In 1970, 70 years old. And just before the pandemic, in the mid-2010s, average U.S. life expectancy came close to 80 years old. 78.9 in 2015 is the exact number I have from Statista. Of course, there have been differences by race and gender and income and other measures. We'll get into those. Interestingly, the race and gender life expectancies have both been narrowing. The decreases have been narrowing. The disparities have been narrowing over time. We'll talk about how and why. And the causes of death, the diseases and things that are not diseases that take people's lives, have changed over time as a function of modern medicine and other things. So today, we're at a point of possible transformation in public health policy with the possibility of people like RFK Jr. and Dr. Oz being in charge of it. Will they add to life expectancy and equity within it, or will their alternative approaches wind up decreasing how long Americans live? And spoiler alert, the increasing life expectancy and decreasing birth rates that we talked about last week could, and in my opinion should, change the conversation the country is having about immigration in the national interest and about healthcare reform. Other wealthy countries are having these conversations too. Some are doing much better than us, and some countries are talking about how can we have more immigrants so we have a better worker to senior citizen ratio. So there's a lot we'll try to get to in this 100 Years of 100 Things segment. Thing number 55, 100 years of life expectancy and causes of death in the United States. And this is part of a pair with last week's birth rate segment. And so we welcome back the same demographer who studies both. It's Mark Mather, Associate Vice President for U.S. Programs at the Population Reference Bureau, a nonprofit that specializes in U.S. and global population data to help inform policymakers. He has written very interestingly, for example, about why American women still live longer than American men on average, but the men are catching up. Mark, thanks for doing this two-parter with us, and welcome back to WNYC.
Yeah, hi, Brian. Thanks for having me back.
Can we start with just the remarkable arc of life expectancy growth over the last 150 years to go from 40 years old on average to 80 years old as almost a steady march upward over the decades, like I laid out, is unprecedented in human history. And like so many other changes in this 100-year series, it seems to track with the rise of the industrial era. Are there some basic realities of the last 150 years that you identify as causing, in general, life expectancy to double in this period of time?
Yeah, I mean, we have had some setbacks for sure, like the 1918 influenza pandemic, World War II, and most recently COVID-19. But overall, the reduction in death rates has been a major public health success story. and in the United States and in other industrialized countries. And I think you kind of alluded to this in your introduction that it's better public health measures that have contributed to a lot of this improvement. So basic things like clean water, better nutrition. We had refrigeration in homes, so we had better food preservation starting in the 1920s, 1930s. And then things like the development of antibiotics in the mid 1930s that helped really reduce those deaths from infectious diseases that were so prevalent early on.
And I have another chart from Statista that compares the leading causes of death, the causes of death in 1900 to the leading causes of death in 2022. In 1900, the leading three causes of death were listed as pneumonia or influenza, followed by tuberculosis, followed by gastrointestinal infections, and none of those are even in the top 10 anymore. Diphtheria was also in the top 10. That's gone from the list too. Now it's heart disease and cancer, numbers one and two. And the number three cause of death these days is accidents. And there were plenty of accidental deaths in 1900 as well, but the diseases that stopped being so fatal allowed accidents to climb to third place. And again, those ones that were one, two, and three in causes of death in 1900 but fell completely out of the top 10 were pneumonia or influenza, followed by tuberculosis, followed by gastrointestinal infections. So that's advances in medical science, right?
Yeah, it's absolutely true that the things that are killing us today are very different than they were 100 years ago. It was infectious diseases back then, accounting for nearly a third of all deaths. And we had this epidemiological transition where it shifted sometime, soon after the 1918 influenza pandemic, starting in the 1920s. We started to see this shift towards what we call deaths from non-communicable diseases, these chronic diseases. And so it became things like, instead of infectious disease, it became things like cancer and heart disease and diabetes, and the things that people often live with for many years, and especially affect people in particular as they get older.
And I have a timeline chart from the think tank, the Hamilton Project, which shows certain milestone medical advances over time. For example, first continuous water chlorination around 1910, then the diphtheria vaccine, the introduction of penicillin, and pasteurization of milk laws, all in the 1920s. So, in this 100-year timeline, exactly 100 years ago, the 1920s, there was a revolution in medical science, vastly diminishing several leading causes of death. Should we also be talking about a marked decrease in infant mortality? Like if more babies are just, making it to start growing after they're born, is that a main reason that we've seen life expectancy go from 40 years old to 80 years old? We tend to look at what kills people along the way, but what about people who really never got out of the gate?
Yeah, exactly. So, you mentioned that life expectancy was 40 or 50 years 100 years ago, but if you made it to 60, you had a good chance of living another 15 years. The main
Huh.
reason that life expectancy was so low is because there were so many infants and infant and child deaths. So around the time of World War I, about 1 in 10 US babies died during their first year of life. Whereas today, it's like 1 in 175 babies who die before their first birthday. So, and what that means is that 99%, over 99% of children are surviving infancy. So that's been the real driver in that increase in life expectancy.
There you go. And were babies dying, if you know, of those leading causes of death in the old days? Pneumonia, influenza, tuberculosis, gastrointestinal infections?
Exactly and in germs that were infecting people because they didn't have clean water, because they were you know feeding kids water that and instead of breastfeeding, they might have been bottle feeding their babies with water that was not sanitized. So that was a major issue.
And today's leading killers, including cancer and heart disease, at the top of the list, it's really heart disease followed by cancer, but they're both pretty close and so prevalent. Also, diabetes increasing in prevalence as a killer into the top 10. Is it just that the other causes mostly are disappearing, and so it makes it look like these are more prevalent? Or if you look at, let's say, the percentage of 60-year-olds 100 years ago who had cancer or heart disease compared to the percentage of 60-year-olds today who have cancer or heart disease or diabetes, has it actually gone up?
Yeah, that's a good question. And I think the research shows that it is both. So people are living longer. And if you're surviving to adulthood and older ages, it does mean you're more likely to die from other things like cancer and heart disease. But if you think about patterns of smoking, that has had a major im effect on patterns of mortality in the 20th century. It was a major driver of increases in cancer during the 20th century. If you think about cigarette smoking, we had less than 5% of Americans who were smokers around 1900. And then by 1965, it was 42%. So things like lung cancer increased dramatically because of some of the behaviors that people had in the 20th century.
Right. And so, continuing on that timeline of medical advances, this one's really just a medical study. We have the Surgeon General's landmark report on smoking and health around 1960. We also have the MMR vaccine around 1970. We also have the first antiretroviral to fight HIV in the 80s. That, of course, was taking a lot of lives for a time and not so much anymore. The Surgeon General's report on smoking, though, 1960-ish, leads us to your article about the gender gap in life expectancy narrowing. And your chart seems to show that back in 1900, there were actually more older men than older women, 102 men versus every 100 women age 65 or older, before women started living longer than men. Do I have that right?
I think women were probably living longer, but yeah, at age 65, we could have seen that kind of a gender difference, partly because at birth we have more males being born than female, and it takes a while for women to catch up in effect. But once you get to those very old ages, yeah, women were still living longer than men.
And in your data, by 1990, the peak year for the disparity, there were only 67 men for every 100 women over the age of 65. So different. How much of that was smoking rate differences? Like almost all of it?
Yeah, this was a kind of a mystery until some researchers at the University of Pennsylvania linked it to historical smoking patterns. So if you look at the kind of the peak years for when men were smoking in the 20th century, it was in the early part of the 1900s, whereas for women, smoking prevalence didn't peak until 1965. So what that basically meant is it took longer for the effects of smoking to kind of catch up to those women. And once it did, their mortality rates started to look much more similar to the previous generation of men. And that's why those gender differences in mortality have kind of narrowed over time.
And related listener asks in a text, what about maternal mortality? We talked about infant mortality.
Maternal mortality rates, there's been a lot of research on this lately showing that there's been a pretty steep increase in maternal mortality in the US. Now, I think a lot of that is due to better measurement of maternal mortality. But maternal mortality rates are highest in the United States compared to any other wealthy country. So they're much too high, and there are really significant racial ethnic disparities with Black women having rates that are about 3.5 times higher than white women. So it's a major issue and one that we have not solved yet.
And we're going to get more into racial discrepancies in a minute. But on the gender discrepancies, by 2020, let's say just before the pandemic, you have the disparity shrinking to 81 senior men per 100 senior women. That's, I guess, from men quitting or not starting smoking anymore and women having started smoking a little more over the course of the 20th century. But that's a big improvement in the ratio. If it was 67 men per every 100 women, and now it's 81 men per every 100 women over the age of 65, something significantly changed in the last 30 years.
Yeah, I, I'm not sure what's causing differences in more recent years, but it's going to have some important social potential consequences for caregiving and things like that. There may be more spouses who are available to take care of their husbands taking care of their wives in old age. The more balanced that those gender gaps in mortality are, I think the better off we'll be.
And we're going to get into the immigration policy implications of what you just said before we run out of time. But listeners, we can take just a couple of phone calls for our guest, demographer Mark Mather from the Population Reference Bureau, as we talk about 100 years of life expectancy and causes of death in the United States. 212-433 WNYC. And I did want to get to some international comparisons, which will probably surprise a lot of people. And Laura in Warren, New Jersey, a physician, is going to lead us into that, I think. Laura, you're on WNYC. Hi there.
Hi, thank you. Can you hear me?
Yes.
Okay, great. Yeah, one of the things that I think it was actually The Economist had a article about sometime in the last few months was comparing mortality from in the U.S. versus other rich countries like Japan and Europe. And all of our mortalities improved over the, most of the 20th century. But then the U.S. mortality kind of has plateaued since the 1980s, whereas mortality in, say, Germany and the Nordic countries has continued to improve over the last 30, 40 years. And you were talking about racial disparities, that the gap in mortality between Black Americans and white Americans has narrowed. Part of that is that lower class white mortality has actually worsened over the last several years due to things like increased drug and alcohol use, increased suicide, and so due to, worsening social conditions, presumably. So part of the reason for the improvement is not a good reason.
Those are all great points and consistent with what I've been reading, prepping for this segment, Mark, right? There's an increase in mortality, and it would affect lower income white people, among others, in probably mostly lower income categories. Causes of death on the rise in this country while others decline include suicide and alcohol and opioid abuse, right?
Yeah, and those are the so-called deaths of despair. They have disproportionately affected white Americans who are in lower income groups and probably living in more rural areas, especially in the South. And the caller's right that's one of the reasons why we've probably seen some convergence in Black-white mortality rates. It's because of that decline and that increase in mortality among those lower income white Americans.
Right. And some of the stats on that, according to the Federal Reserve, which tracks this, in 1900, the average life expectancy for whites was more than 45 years old, and for blacks, less than 35. Just before the pandemic, the difference was about 75 years of age for Black Americans on average, around 79 years old for whites. Still a meaningful disparity, but not nearly what it was in the earlier years in percentage terms. And we see that life expectancy also tracks with income. And we know there are ongoing wealth and income disparities by race. So do you have anything, you study population, maybe not poverty policy as much, but do you have anything on what has caused the narrowing of the gap in addition to more deaths of despair among lower-income whites? Has it been largely the advent of, say, Medicaid in the 1960s and other health care cost buffers for people of lower incomes who disproportionately tend to be people of color?
Yeah, I think it is certainly healthcare is a big part of it, that we've got better healthcare, especially for Black Americans living in the South. But I think research has shown that it's not just a single factor, but a combination of things. Because we've seen reductions in cancer, HIV, we've seen a decline in Black deaths due to homicide, lower infant mortality rates. So it's really been a combination of things, I think, that has contributed to that improvement.
And the caller mentioned international comparisons. In general, we have lower life expectancies now than all of the following countries. And this comes from a chart from healthsystemstracker.org. But for people who think about American exceptionalism and we're so advanced and we have the best healthcare, which we don't, the United States has lower life expectancies than Germany, Austria, Britain, Canada, France, Belgium, the Netherlands, Japan, Australia, Sweden, and Switzerland. All of them have longer life expectancies than the United States. These are 2022 numbers. And so the average for all those other countries I've listed, according to this chart, is 80 years old for men, 84.4 years old for women in all those countries on average. In the United States, it's 75 years old for men, full 5 years less, 80.2 years old for women, 4 years less. So that's something you've looked at, Mark, right? The United States trailing other wealthy industrial countries.
Yeah, absolutely. And if you look at those data, I think what you'll find is that people with college degrees in the United States are doing as well or better than the folks in those other countries in terms of life expectancy. It's the people who don't have college degrees that are really falling behind, and that's been kind of an accelerating trend, so that people with a college degree today can expect to live about a decade longer than those who don't even have a high school degree. And that's where we're really failing. It has to do with lots of factors related to health-related behavior, access to health care, and good social policy is good health policy. And I think you mentioned poverty, and we've got pretty significant income inequality in the United States, and a lot of that is contributing to these disparities.
Dale and Chelsea has a history question. Dale, you're on WNYC. Hello.
Hello. During COVID, I was watching a lot of old movies, and there's a movie in 1950 called The Killer That Stalked New York, and it basically highlighted, in reality, there was a smallpox epidemic in New York, and they even had some anti-vaxxers in the movie, but the mayor got all of these pharmaceutical companies together and asked about vaccines and said, we need to triple those. And he had, thousands of people vaccinated and got rid of the smallpox pandemic in New York. Do you know about this?
Mark?
I don't know about what happened with smallpox. I know, with like polio vaccine, we had a very successful campaign that effectively eliminated polio in industrialized countries. So I would think that the same type of thing happened with smallpox. We were able to largely eradicate a lot of these nasty diseases through educating people about vaccines, and they were successful.
Right. And we didn't mention them at the beginning, some of those causes of death that vaccines have prevented, except diphtheria, which was in the top 10 and has, fallen way out of that because of the diphtheria vaccine. I guess it's because polio and smallpox may have been big killers, and polio, of course, a big cause of disability, but maybe not in the top 5 or top 10 causes of death, but still significant causes of death. And vaccines have, so effectively wiped those out. And I certainly don't see anything about vaccines themselves as significant causes of death, but, it happens rarely. But I guess we're about to enter into a new era of policy conversation, at least over that, right?
Yeah, that's certainly a possibility. I think you're right about the polio and smallpox vaccines. You would often have outbreaks, and maybe they didn't have the same kind of effect that some of these other infectious diseases have. But polio can have lifelong debilitating effects, even if you survive it. So I hope we don't go there, but it's been part of the conversation, so we'll see.
And we're going to be covering part of that on tomorrow's show, folks, with New Jersey Congressman Frank Pallone, who's the ranking Democrat now on what's called the Energy and Commerce Committee, but they deal with all the health policy. So we're going to talk about that tomorrow. Before you go, I said we'd touch on immigration. One thing you've written about several times is the need for more immigrants to keep our workers to Social Security and Medicare recipients ratio healthy, not just the government financing of those programs, but also having enough healthcare workers to go around for all these 90 and 100-year-olds who the population didn't used to have. Do you think the immigration debate in the U.S. is missing that component as we focus on legal status and mass deportation, beyond those who've committed serious crimes?
I do, and I think it's something we're going to have to really look at closely, even if it's just within a particular sector like healthcare. We've got such a rapidly growing population of older adults, all these baby boomers who are going to need a lot of healthcare. And, with the fertility rate as it is and a relatively old population, we may need to turn to immigration as a solution to really balance those needs. And there's other sectors as well, I think, where we should really start talking about immigration as a potential benefit, and not just look at the potential detriment to the economy, because we're gonna definitely have a deficit in the coming decades.
And other countries are having these conversations too, right? Age ratio. Like I've read that Japan is about to start encouraging more immigration, which is not generally a Japan thing. Do you know about that at all in global terms?
Japan is the oldest country in the world, and they've been managing pretty well for a few decades now. They've got, policies in place to encourage people to continue to work well into old age. They've got a pretty, government-run healthcare system for older adults that meets most of their needs. But I think they're now at the point where they see that immigration is the only solution to some of their challenges with the age distribution. So we're going to get there as well at some point, and I think it's better to start planning for that now rather than waiting until really we start to feel the consequences of population aging.
Mark Mather, Associate Vice President for U.S. Programs at the Population Reference Bureau. Thank you for doing 2 segments in a week with us on the birth rates and now the causes of death and life expectancy. We really appreciate all your knowledge and you sharing so much time.
Well, thanks for having me.